everybody. Hello, hello. Good afternoon, everybody. We'll give folks a couple of minutes to come in. Hello. Happy Saturday. It's Self-Care Saturday. It is. And it is August 1st. Thank you for joining me. Throw your name in the chat, say hello so I know who's here. Hello, hello, everybody. It is August 1st. Can't believe it. 2020 is moving right along. Not really upset about that. And it's also my birthday month. So there's that. Hey, Rainies. Happy healthcare Sat. Why do I keep saying healthcare? I showed you what I do for it, what I think about all the time. And I'm sleep deprived, so forgive me. It's self-care Saturday. I clearly need to do a little self-care. All righty, let's jump right in this thing. I am Dr. Kelly, your board certified internal medicine physician, speaker, and patient care advocate. I am committed to ending healthcare disparities within minority communities. Through my advocacy, I help patients become better educated consumers to improve their healthcare outcomes. And it's Self Care Saturday. Welcome, welcome. Hello, everybody. So today we're going to talk a little. I have a couple of questions that I'm going to answer that people have asked. And if you have a question, you can throw it in the chat, and I will try to get to it. So let's jump right in. So let's actually before we get into that, let's just tackle Self-Care Saturday, right? So we always talk about a couple of things that we can do in different ways to achieve self-care. So some of those are just getting some rest, getting some sleep, relaxation, massages, exercise, reading, meditation. One of my favorites, retail therapy, known as shopping, online, of course, in these COVID days. So I hope you are doing something for yourself today. My self care is going to come on the back end of the day. This has been a crazy day so far. Worked overnight and I am still up because I had a conference. I am actually still in a conference, but took a break to do this. So y'all pray my strength because your girl's sleep deprived. All right. So let's jump right into it. So yes, I am an internal medicine physician, board certified in internal medicine. And people always ask me, so what do you do? You work at a hospital. Okay, so you're in the emergency room, right? And so the answer to that question is yes and no. So I am not an ER doctor. I do spend a nice chunk of time in the emergency department, but I am a hospitalist, which basically means that I see patients in the hospital setting only. So I don't have an office. Um, I don't see patients outside of the hospital for any reason, right? And then to make it even more fun, I'm actually presently working as a nocturnist, which basically means a hospitalist who works at night. Okay, so I'm the person that's up at 3 in the morning when everybody else is asleep, and I'm asleep at 3 in the afternoon when everybody else is at work. That is my official title. So, board certified in internal medicine, and I am a hospitalist and a nocturnist. Okay, so those are kind of terms that you may hear me say. And so people always say, well, what do you do? What exactly do you do? So when patients come to the hospital, they come for various reasons. Certain things fall under different specialties. The vast majority of folks that come to the hospital, especially smaller hospitals, are going to be admitted to the hospital by a hospitalist, right? So let's fast forward maybe 20, 25 years ago. The vast majority of community doctors, so your doctor that you see in the office, would also see you in the hospital. They had their own office, but they also had hospital privileges. So they would see their patients in both settings. Well, as time has gone on, medicine has improved, healthcare has improved, so has the average lifespan has been lengthened, right? So most folks, the average age, we have folks that live into their 80s, their 90s, even some into the hundreds. So somebody's got to take care of all these folks, right? So this kind of started with the baby boomers. So it became really logistically difficult for doctors to see patients in their office and then also go and see patients in the hospital. There's only so many hours in the day, right? So thus my specialty was born. So hospitalists have been around about 15, 20 years or so now, really popular in the last probably 15. And so that's basically what we do. So we take other folks' patients, community patients from other doctors, when they have to come into the hospital for whatever reason, they are admitted to the hospital by someone like me. So what types of things do we do? What do we see? What do we take care of? So anything from heart attacks, strokes, uh, diabetes, high blood pressure. Um, Most of the time, we end up admitting the orthopedic patients. So folks who have come in, they broke a hip or got into a car accident and sustained some trauma. The bigger hospitals have trauma teams, and the trauma teams take care of trauma patients. So, car accidents, you fell off a roof, you fell off a ladder, whatever the case may be. And Smaller hospitals that don't really have a trauma service or don't have a trauma team that may have a hip fracture or whatever. A lot of times they'll have medicine admit the patient and they will do the surgery and we manage all their other issues. So they have high blood pressure, they have high cholesterol, whatever the case may be. So basically, everything that your doctor can do in the office, for the most part, we deal with the higher acuity things of that. So you're having chest pain, that comes to me. You're having slurred speech, that comes to me. Your blood sugar is 500 or 800, that comes to me. We also manage ICU patients. So we can manage ventilators. We do have critical care experience. Your smaller hospitals, we typically run codes, especially in the middle of the night, for hospitals that don't have dedicated ICU staff. So your hospitalists do quite a bit. And we have quite a diverse skill set. So that's a little bit about the things that I treat and what the things that I take care of. So another question is, okay, so let's a little bit more about what we do. So we basically get you into out of danger, right? So we figure out, okay, your chest pain is not coming from your heart. It is in fact reflux. Okay, so we get you patched up and we send you back to follow up with your doctor. Or this chest pain is concerning. We need to get cardiology involved, and we do that. So we're kind of the gatekeepers in the hospital for probably 85% of the patients that are in the hospital, if not more. So it's our job to basically handle the emergent things, the things that can't be done outside of the hospital. Your blood pressure is 200 over 100, right? Your doctor can't manage you in the office. So they send you to the emergency room. The emergency room doctor calls us to say, hey, I've got this patient. His blood pressure is elevated, or he's having slurred speech, or whatever the issue is. And then we take over. So we manage your care while you're in the hospital. And then once you're stable and we've gotten you out of harm's way, essentially preventing a poor outcome, then we refer you back to your doctor that's in the community. So that's essentially in a nutshell kind of what we do. And we determine who needs what specialists. So we kind of manage all the care for all the patients, no matter what they came for. And some people have multiple specialists. So there's kidney doctors, heart doctors, lung specialists, um, you name it. And so we manage all of that to make sure that nothing gets missed, that the follow up is set up. So that's a little bit about what I do. Specifically for doctors like me who work at night, um, I always joke it's our job to keep everybody alive until 7 a.m. So, in my current capacity, I'm not so much managing the day to day. I basically admit you to the hospital, get all the things ordered, get you moving down the right path. We also treat things like urinary tract infections, pneumonias. So I get you started, and then the next morning, one of my partners takes over, and I don't see you again. And that's kind of the thing I love about working at night, is that we get brief interactions with patients. We get you started, get everything ordered, get you set up for whatever testing you might need, and then we pass you on to the next person. So that's a little bit about what I do um, in the middle of the night. So another question, are you currently taking care of COVID patients? Yes, indeed I am. So COVID patients come to hospitalists. And so, depending on the size of the hospital and depending on the state that the patient is in, do they need ICU level care? What are they needing? Because of the number of COVID patients that exist, we can't admit everybody. So, we do have criteria for who needs to get admitted and where they need to go in the hospital. So you may test positive for coronavirus, but you don't need oxygen. You're doing pretty well. You just have a nasty cough, or you got a high temperature. So we don't necessarily admit everybody because the whole hospital would be full. Everybody would be there. So unless you're needing oxygen, having some other issues, blood clots, things like that, most people we are sending home. And then you're admitted to the hospital when your oxygen saturations are low. We need to get other things set up for you. You cannot quarantine at home because you live with 10 other people, whatever the circumstance may be. So, yes, I am currently responsible for taking care of COVID-19 patients in the hospital setting. Um, we see patients in every stage of the illness. I've seen patients that are on the ventilator. I've seen patients who are there and just need some oxygen support. So pretty much the whole gamut of coronavirus patients I've seen and taken care of. We also take care of any number of complications. So I've seen patients with blood clots in their legs, blood clots in their lungs, folks that were discharged and are now coming back because they're worse, folks who are oxygen dependent. So kidney failure, as a result of COVID. So pretty much anything related to coronavirus and the complications thereof, I've seen and taken care of. So um, yes, I am actively involved. For those of you who are just joining us, come on in. Thank you for joining us. Welcome. It is Self Care Saturday, and I am answering your questions today. So we had a couple talked about basically what I do, being a hospitalist, what that means. So if you are watching this as a replay, just put hashtag replay in the comments. So I think the last question is, when would I need your help? So the short answer is hopefully none of you need my help. But basically, if you, anything that requires you be admitted to the hospital. So, I mean, literally anything that requires somebody to be admitted comes to my service for the probably about 85% of the time, with rare exception. So infections, things that need antibiotics, pneumonia, COVID, blood clots in the legs, in the lungs, kidney failure, liver failure, cirrhosis, transplant patients, um, heart attacks, strokes. Most of that comes to us. The very few exceptions to things that we don't directly take care of, and the vast majority of those are going to be so like a trauma case. 20-year-old gets into a really bad car accident, and all of their injuries are basically trauma related and surgical in nature. Those typically don't come to the medicine service. But any complications thereof, or if they also have diabetes or something else that needs managing, usually we get consulted to manage those things. Um, let's see, cancer. We're the gatekeeper for most cancers. So you come in, you got a nasty cough, we do a chest x-ray, we find a mass, we do a CT scan of your chest, we are pretty convinced that it's going to be cancer. We coordinate getting biopsies and getting results and all those types of things. So pretty much all your cancers fall under the umbrella of internal medicine. We get the specialists involved, so the oncologist, or if it's for a woman, it's in a pelvic organ like the ovaries or the uterus or the cervix. Then there's a special oncology team for that. But by and large, making the diagnosis comes to medicine. Cancer patients with uncontrolled pain comes to medicine. So pretty much most of what people come in for falls under the medicine umbrella. So um, I think that's all the questions I got. Any Rainies? Do you guys have any questions? I can't see who else is in. If you're with me, say hello. I can see that there's people watching. I just can't see who. So if you guys have any questions about what hospitalists do or anything related to that, throw it in the chat and I will answer it. But I pretty much wanted to give you guys that information. Um, there's several of you watching, so hello, hello, hello. Welcome to Self Care Saturday. I'm just talking a little bit about what it is I actually do for a living. People know that I'm a doctor, but they don't know what kind or what actually it entails. So just wanted to give you guys the opportunity to ask some questions. I'm going to see if I can, so I'm having a hard time actually seeing the chat. So let's see if I can actually look at the comments. Hello, Carlisa. Thank you for joining. It's Self Care Saturday. We're glad you're here. Let me see. It's hard to see all the comments. So let me see. Okay. So that's pretty much it. My relationship with patients and what I've seen in the hospital is kind of what has prompted me to want to do more in the realm of patient advocacy. There's so many things that our patients don't know, so much information that they don't have. And so, if someone, particularly for minority patients, they usually have lack of access and usually are underinsured or have no insurance. Um, we tend to present to the healthcare system a lot later than our white counterparts. So when our cancers are discovered, they're stage 3, stage 4, and at that point it's kind of too late. We don't get all the surveillance studies, so mammograms for women, pap smears, all of those types of things, prostate exams for males. So we just typically are always behind, and it's not until our conditions, whether it's cancer or heart disease or whatever it is, we are presenting very late. And usually by the time you have symptoms, it's too late. Hi, Stissy. Hi, Nugget. So usually it's too late when by the time we present. And so our options are limited. And you're basically a day late and a dollar short. Whereas our white counterparts are in surveillance programs, they're getting mammograms, they're getting, um, their prostate exams and things like that. So things are getting caught a lot sooner. So that's part of the reason why I want to get into patient care advocacy, because it's a part of what I do for a living anyway. But there's no one that looks like me who most of the time sees patients. And so I get that all the time. You're going to be my doctor? Wow, really? I'm so proud of you. And I'm like, okay, that's great. Let's talk about this mass that is in your chest. But people tend to respond better when the person giving them information, the person educating them, looks like them. And so there is a real need in our communities for Black and Brown faces to educate our people. And to get the information out there so that we do have a chance to survive some of these things, um, breast cancer and lung cancer and all these things. So that's really the purpose behind some of the work that I'm doing, trying to improve our healthcare outcomes for Black and Brown communities. Because I mean, COVID is a prime example of the problems that have long existed. We have healthcare disparities, we have income disparities, um, disparities all across the board for Black and Brown folks, and it's been this way for hundreds of years. And so we have to make these little small incremental changes. And so this is just my way of paying it forward, giving back, and just kind of impacting my little corner of the world. So if you guys don't have any other questions, I've answered all the ones that I have. I'm so grateful and thankful for you being here and for your support. Like and share this video. The more people that I'm in front of, the more people I can help. And there's nothing like having people follow you and you don't even know who they are. And I see that every day. My Dr. Kelly page has over 700 likes, which is insane because that's almost as many Facebook friends as I have. So pretty cool how many folks are sharing my tips and everything with other people. So I appreciate y'all. I appreciate the support. Thank you for spending a little bit of your Saturday with me. And I look forward to talking to you again very soon. Have a wonderful rest of your Saturday. I love each of you. Like and share. Have a great one.